Good evening, everyone. My name is Driti. I'm one of the medical student representatives this year for our RAMS board. It's really a pleasure to have all of you with us this evening. We thank you for your time, and we hope that this will be a very informative and useful session for you. Given the COVID-19 pandemic, there have been a lot of changes this year regarding the upcoming application cycle, away rotations, home rotations. So we have a panel of 4 wonderful people who are assistant program directors as well as clerkship directors to kind of give some advice regarding how their programs are planning to handle things this year, how they are advising their students, and kind of give you all a little bit of an idea about how different people are planning to handle the application cycle this year. So we welcome you on board. I'd like to take a moment to guide you towards this link. There was recently a consensus statement released by multiple emergency medicine organizations around the country regarding this upcoming process. A lot of our conversation will be centered on some of the points in this, and so if you want to keep this page open for your reference, it would probably be a benefit for you. Moving on to introduce our panelists, we have with us today Dr. Nicholas Hartman, MD, MPH. He's an associate professor. He's the associate program director of the Department of Emergency Medicine at Wake Forest University. We have with us Dr. David Story, MD. He's also an assistant professor, clerkship director of the Department of Medicine, Emergency Medicine at Wake Forest as well. We have joining us Dr. Simiao Lee Sauerwein, MD. Hi, Dr. Sauerwein, Assistant Residency Program Director at The Ohio State University Wexner Medical Center, and Dr. Christopher San Miguel, MD, Emergency Medicine Clerkship Director at the Ohio State University Wexner Medical Center. So welcome to all of you. It's really a pleasure to have you with us tonight. Before we get started, a few housekeeping things. We have disabled the chat for now. We will be going through about 90 minutes of pre-formulated questions with our panelists, and we will be opening up the chat at the end of this session for individual questions that our panelists can answer for you. So the chat will be open towards the end of the session for you to go ahead and ask your individual questions. So if you don't mind, please keeping yourself on mute as well, it would be much appreciated. So moving into our content. So as our panelists and all of you know, there have been a lot of changes this year. Various organizations have come forth and consensus statements have been written recommending that away rotations be canceled for or discouraged for many institutions, with specific exceptions for people who may not have access to a home rotation. Regarding emergency medicine rotations, this question is more directed towards our clerkship directors, Dr. Story and Dr. San Miguel. How are your universities planning to handle the fact that you can now really only give your students 1 rotation? And what do you suggest for students that might not have an EM home rotation at this time? Dr. Story or Dr. San Miguel?
Sure. I think, we're at Wake Forest, we have an emergency medicine rotation. And what I think most of our students are planning on is having that as their only EM rotation during their 4th year. Our school is discouraging travel away from the area towards other programs in other areas of the country just for, fears and recommendations within the situation with COVID-19. So I think it's the new reality that if you come from an institution where you have an EM rotation, you're fortunate enough to have one, then that is likely going to be your only EM rotation. For those folks who are at institutions where they don't have an EM rotation, I think that's where there's a lot of anxiety about this whole process is where am I going to get that experience? Where am I going to obtain a SLOE from? And I know that there are institutions out there that are offering away rotations and are specifically considering students from these programs that don't have access to EM rotation. So that would be my first recommendation to those students specifically, is to really seek out those programs that are offering away rotations that are almost earmarked for students that don't have home EM rotations. And I think, you know, CORD and SAEM have all come out as a proponent of that process of really kind of keeping those specific students at the top of the list for any away rotations that are available. I can tell you at Wake Forest itself, our decision was made for away rotations that we were going to stay regional. So if you were within North Carolina and did not have a home EM rotation, then you could, in theory, come and do an away with us. Unfortunately, all of this institutions within North Carolina have an EM rotation. So we actually will not be accepting any away rotations, any away rotators at all. But different places have different guidelines right now on what they're accepting.
Thank you, Dr. Story. Dr. San Miguel, could you give us some input as to what Ohio State is doing right now?
Yeah, I think Ohio State has a similar approach to what it sounds like Wake Forest does, and what I suspect a lot of big academic centers do. You know, unfortunately, at the beginning of our academic year, which actually for us starts in May, we had to take students off of rotations for a bit. So in addition to this thought of limiting epidemiological spread and equity being both behind reasons to limit away rotations. In addition, we have this third kind of component that is we still, as a required rotation, need to fit all of our home students through our emergency department. So unfortunately, Ohio State this year won't be taking any away students for emergency medicine. I would echo Dr. Story's advice though. You know, if I were a student right now who went to a school that didn't have a home EM rotation, I would really target emergency medicine residency programs that are loosely or not affiliated at all with medical schools right now, because they won't have that additional problem of needing to fit in additional students from their own institutions. And they are more likely, I think, to have space available to take you for your one EM rotation.
Thank you both.
Can I add one thing, Drisha?
Sure,
The thing that popped into my head. There are some places, I think Southern Cal is one of them, that actually has 2 training sites. And I know there's several other places that do that. And there's been discussion on some of the message boards that at those institutions, even those institutions are going to limit their home students to 1 training site, which potentially opens up positions at the other hospital, the other training sites. So that may be another avenue for available spots.
Excellent. Thank you so much. Moving on, very similarly, if you've already covered it, feel free to defer, but along those lines, what other rotations are you recommending students do? For example, if they can't get an EM rotation, or in addition to their home EM rotation, what types of rotations would you recommend that students should consider? Dr. Story or Dr. San Miguel?
Well, if you are fortunate or just happen to be in the situation where your home institution does offer what we call kind of EM subspecialty rotations, those are always a good opportunity to continue to get exposure in the field and kind of build your emergency medicine knowledge. You know, ones that come to mind are like emergency ultrasound or EMS or toxicology. But in addition to that, I may be in the minority in this thinking, but a lot of students, I think, had their 3rd year cut a little bit short this academic year because of the pandemic. So, you know, this may be an opportunity to kind of make up for any missed opportunities from 3rd year that you didn't have the chance to take part in. And I think that's really important in emergency medicine, being such a broad field. Really, all of those rotations from 3rd year are really important to build your foundation for, you know, your clinical knowledge for the rest of your career. So if your pediatric rotation got cut a little bit short, I would consider filling in a pediatric rotation your 4th year so that you're comfortable seeing kids when you hit the ground as an intern.
Thank you, Dr. San Miguel. Dr. Story, do you have anything that you'd like to add to that?
I definitely think, the emergency medicine subspecialties is a great place to start. Not only does it get you the experience that Dr. San Miguel was talking about, it also gets you some face time with emergency medicine folks that may make them a little bit more willing and likely and able to produce a meaningful recommendation for you, whether that's the non-EM SLOE or exactly, what that looks like in a couple of months. The other core kind of rotations that I would consider if you find yourself with some extra time, considering that you're not going to do an extra 1 or 2 aways, are things that are going to benefit you down the line. Just like Dr. San Miguel was saying, if you're filling in from third year, great. If you feel like your third year was pretty rounded out, anesthesia and getting to do a lot of tubes, anything critical care, any of the ICUs that you can rotate in are going to get you more used to seeing and treating high acuity patients. Radiology is hit or miss depending on where you are. Something like an ophthalmology rotation, if you had 2 weeks where all you did was slit lamp exams, that could be really beneficial in the long run. So, I would probably start with the EM-based ones, but then I would spread out from there with an eye for things that you're going to need within emergency medicine, specifically towards critical care stuff.
Thank you very much. Those are excellent, excellent points. Moving on to SLOEs and non-SLOEs. And again, we'll have time at the end for questions. So in case any of you have questions kind of burning in your mind right now, hang tight. We'll definitely get to those at the end. So more directed towards our assistant program directors right now. The potential for students having 1 SLOE this year, or even no SLOE on how we're doing those things. How are things going to be handled from a assistant program director's side? Dr. Lee Sauerwein or Dr. Hartman?
Yeah, that's a great question. Thank you, Driti. So, the consensus statement put out by SAEM says that we really only recommend 1 SLOE per applicant. And like that, in prior years, the expectation was probably 2 or 3 SLOEs written by different departments of emergency medicine. This year, we really, truly only expect 1 SLOE. So it's like not a trick. It's definitely, what we actually want from you. And the expectation is that when you're rotating, and if you're lucky enough to have a home institution, that SLOE is written by a panel of writers. So typically that can comprise the clerkship directors, some of the residency leadership, and folks who've worked with you clinically. So they really have had a chance to kind of get to know you from multiple contacts throughout the course of a rotation, and perhaps even beyond that rotation, either before 4th year or in a non-clinical setting. So I think that the 1 SLOE from my standpoint is, we really expect those programs to be honest in terms of what your strengths are, what your areas for potential growth could be, and what your potential during residency is. As far as students with, no home institution, where worst case scenario, you aren't able to get an away rotation, I think that, that's where we're really going to lean on the non-SLOEs. And I'm eagerly awaiting the formatting from CORD to see what that's going to look like. But I think the benefit of the initial SLOE letter is that it sort of allows for folks to, view you in the context of applicants for that year, and to give folks a way to objectively describe you as an applicant. And so I think that these are all good things that, you will get a fair and a balanced description within your single SLOE. And if not a single SLOE from your home institution, then the non-SLOE.
Dr. Hartman, do you have any thoughts towards this?
Yes, I completely agree with all of those points. It really is not a trick. We really are going to be looking for 1 SLOE. I do want to add a little bit of a disclaimer to sort of frame a lot of this conversation, in that a lot of this seems a little uncertain to you, and it seems very uncertain to us too. It's how we're going to actually handle the process of selecting candidates to interview, and all of that is going to be a little bit new to us. So you're going to experience probably some variability in how different programs choose to view things. But I think that this one is an area where we do have very clear guidance and I think real consensus that we really are looking for one SLOE. I think there has been a bit of a myth in the past that the more SLOEs you get, the better, and that's really just not always true. So please do abide by that. Look toward that. There's, as we'll discuss a little bit more later, there's other there will be other avenues for you to get more recommendations from non-EM SLOEs or other avenues. So those will be available, but I would really recommend that you stick to one SLOE.
Thank you. Along those lines, do you think if a student does have more than one SLOE, would there be any perhaps like negative repercussions? Like, would it be viewed as something negative, or would it be viewed, it should not be viewed as anything positive above other people, correct? If by chance they were able to have multiple SLOEs.
Well, I think you would want to be a little bit careful with that. If you are obtaining multiple EM SLOEs, you'd want to be able to provide an explanation for why that was, or some rationale, because this is to some extent a question of equity and fairness, and making sure that everybody gets a chance to who wants to gets a chance to do an EM rotation and obtain a SLOE.
Thank you.
Yeah, I would echo that as well. It really should be in the consensus statement says that this is in cases of extenuating circumstances, and it really should be an extenuating circumstance, and you should be able to explain very clearly why you needed to get a second rotation in.
Thank you. This is towards Dr. San Miguel and Dr. Story. Are you recommending that your students try to get SLOEs from the subspecialty rotations, for example, tox and ultrasound? What are your thoughts towards kind of trying to get SLOEs from other subspecialties right now?
I think it's a reasonable attempt. Again, if you are fortunate enough to have some of those subspecialty rotations at your institution and they are offering to write you a SLOE, I don't think that there's any reason to turn it down. I think that is, going back to the last question that Dr. Hartman and Dr. Lee Sauerwein answered, I think that's not really an extenuating circumstances stance. That's just your opportunity at your place. And it's not as if that you were taking that spot from an applicant that could not get, a similar rotation somewhere else. So I don't think it should be viewed negatively in that regard. I think that is completely explainable for an applicant to come away with that. I can't say for certain if, a SLOE is what would come out of our subspecialty EM rotations here. Because it's not necessarily going to fall under the same specifics and the same requirements that a standard EM clerkship or acting internship would require. So it would probably still fall under a non-SLOE or outside letter of recommendation category, I would think. I don't think our subspecialties would be actually putting an official SLOE in following those rotations.
Thank you.
Yeah, I largely agree. I think the court has come out with like a subspecialty SLOE for kind of guidance for writing those types of letters that isn't quite at the end of the spectrum of like an official SLOE, but still isn't just kind of like a full narrative letter of recommendation. If you have that opportunity to do that rotation and they're willing to write that subspecialty SLOE for you, I say go for it. But I think the big message both nationally and from what I've heard locally is that we aren't expecting people to have those subspecialty SLOEs. If you happen to have it as part of your application packet, okay, great. If you don't happen to have it as part of your application packet, okay, great. We'll deal with it either way.
Thank you both. And now directed towards our assistant program directors. For a non-SLOE, we know that CORD and CDEM are currently working on a template that should hopefully be coming out soon. What are you looking for in a non-SLOE? Like what characteristics would you hopefully like to see? And is there a specific specialty that you might like to see a non-SLOE coming from? For example, like a critical care doctor or a critical care non-SLOE or something along those lines.
I think it's a bit difficult to know for sure until we get those templates to see what those look like. I think my understanding is there may be some different categories for these non-EM SLOEs. So they would be in some way, it's a little different concept, but typically our standard letters of evaluation are just for EM rotations, but we're going to open it up now to have standard letters of evaluation that fit other specialties. As we discussed earlier, I think it's useful to get those from other EM subspecialties. That those are useful letters, even though that's not actually a true EM rotation. Those are written by EM docs, and so that's helpful in that sense. Otherwise, I think that specialties that are sort of adjacent to emergency medicine would be helpful. You mentioned critical care. I think that's a great one to consider. Even specialties like internal medicine or surgery that have strong interactions with emergency medicine and would be able to speak well to some of your characteristics that would make you a good fit and able to do this job in our field really well. I think those would be good options too. But somewhere where you performed well, where they can speak well to your particular skills and talents.
That sounds good. Thank you.
Yeah, those are great points. I think I would also add to that I would like to see someone who knows you well, but can also offer a balanced opinion of your abilities. So I think that, folks who've worked with you very closely over the course of 3 years or so, sometimes those folks can really think that you're the bee's knees, right? And so we want people who know you really well, but we also want people who are able to put you in the context of that field of applications for the year. And I also echo what Dr. Hartman said in that specialties that are more adjacent to emergency medicine. So, sometimes procedural specialties like anesthesia, critical care, those would be more helpful to me, I think, than some of the specialties that might be a little bit further away from, our procedural sort of undifferentiated patients.
Thank you both. Okay. Moving on to applications. So, given that there are so many changes this year and, away rotations are canceled, there's a lot of different factors. What would you, Dr. Lee Sauerwein and Dr. Hartman, what would you recommend students should try to highlight more in their application given so many changes this year?
I think for me, this, hasn't changed a ton in terms of what I am looking for at the heart of it all. Like when I'm reviewing your application on paper, or rather on my laptop, the things that I really want to see that make me want to pick somebody out of the pile is someone who's shown really excitement or commitment towards a specific project, or really been invested in something. I love to see that passion. And I think it's also important, with respect to your personal statement, which I may be jumping the gun a little bit there, but I want to talk about is to really explain kind of what makes you tick, who you are as a person, because we won't get to meet you in person until you show up on interview day.
Completely agree. And this is, again, an area where I would caution that any thoughts that we're having or advice that we have may be different in different places. And I think every program is going to be feeling this out and sorting out for themselves the best way to review with missing some of the information that we would normally have. But I really agree that highlighting the experiences that you've had in life, the things that you've been involved in, showing that you have had a real commitment to something and seen it through. I think that's much showing that, or telling that story, is a little bit more powerful than kind of naming every small thing that maybe you've been involved in. So I would really urge you to highlight those things and make them clear through both the CV that you put up as well as your personal statement. Other things that are going to get a little bit more attention than they typically would, I would guess, would be things like med school grades and evaluations. Those are important anyway, but they'll probably become a little bit more important as we have less SLOEs to go off of. We're not getting some of the standardized tests as consistently as we might in other years. So those things might be highlighted a little bit more.
Thank you. So along those lines, what would you recommend students also try to put into their personal statements? What should they focus on? I know a lot of people and other students I've talked to have actually said that they would be talking about kind of what they've experienced during this pandemic. But do you have any thoughts about, what maybe students should try to focus on in their personal statement, and perhaps how much they should focus on how much they've been affected by the pandemic and their rotations being canceled and things, or whether that should be left more to, for example, an MSPE?
Yeah, I think it's tricky, and it's hard to give kind of general advice for something as personal as named personal statement. But I would say if the pandemic has had a significant effect on you and your decision to go into emergency medicine or your path to medicine, by all means, feel free to bring that into your statement. But I wouldn't approach your statement as an opportunity to explain the same limitations that everybody else has in their application. If there are specific circumstances kind of above and beyond COVID that you want to take the opportunity to explain your personal statement, I think that's great. But I wouldn't necessarily say, well, I only have one SLOE because I only did my one home away rotation because of COVID, because I think we already kind of know that. So I would use your statement to answer the question of why should a program decide to interview you.
Thank you. Anybody else on our panel want to comment on that?
I think, oh, sorry, Nick.
We all want to chime in. This is epic.
This is great. That's what we want.
I think for me, I definitely agree with what Dr. San Miguel is saying, is that, we already have that baseline assumption about the limitations for the year. I think everyone to some extent has been affected by COVID and has had seen things unfold both personally and also professionally. So I think if there's a specific instance that you want to talk about with respect to your decision for EM, that's helpful. I think in the past, some of the advice floating around would say, try to make your personal statement just not stick out in a bad way. And that it's a little bit better to have a bland personal statement than something that, is a little bit too out there. But I think for this year, I would probably go back to making that personal statement personal. Tell me more about you as a person, because I'm not going to know about it until you show up.
Thank you. Dr. Story or Dr. Hartman, do you have anything to add?
I agree. I was going to say something I think fairly similar. I probably have given similar advice to what was referenced there, that I've often told students that to please try to make your statement personal and do well with it, and make it professional. Please don't let it disqualify you. So make sure that that you don't try to write it in iambic pentameter or something crazy. But I do think that this year it's going to be looked at a little bit more, and you'll want to, within the bounds of reason and all that, you're going to want to try to make it personal and really explain to us what will make you a great resident, and what has brought you to this field. So it is a little bit bigger challenge. I would definitely make sure that you spend some time on it, and get good feedback from trusted mentors and other people who know you well and can comment well on it.
Great, thank you so much. So again, we recently got word that Step 2 CS is going to be canceled for the next 12 to 18 months. This was recently released by the USMLE on May 26th. And I know a lot of students are also having trouble with Step 2 CK scheduling. What advice do you have for them? Will this really affect their applications if they don't have CS and CK? You had kind of mentioned that you might be looking at med school grades instead, but will a lot more weight be put on Step 1? What is your advice from a clerkship director's point of view, as well as how are you guys kind of viewing that from the program side?
I think my specific advice for this, as it is, I think in general for the application season, is don't panic. Everyone is in the same boat. Um, you know, I think for us, step 2 CS, you know, the bar for passing is low enough that I think we pretty much expect for you to pass. And so that is, you know, it doesn't really weed out a ton of people, to be honest with you. And in terms of the step 2 CK scheduling, I think ultimately it would be nice to have when we're finalizing our rank lists. And sometimes it kind of gives us information with respect to your trajectory from step 1 to step 2. But I don't think for me it's a must have to invite you for an interview. I think in most cases it can really only help you once that information comes along to then forward it to us before the end of the season.
Thank you.
I think the student that's really affected by this is a student who may not have scored as highly as they wanted to on step 1, and are really seeking out that step 2 CK improvement. They want to showcase that, you know, where they've come over the last, you know, year of clinical knowledge and clinical experience. So from that regard, if I was advising a student that came to me and they had a really strong step 1 score, I might advise them again to speak about equity amongst the applicants, to say, look, you know, your application based on your test scores are, you know, looks very strong right now. Perhaps even you just accept a slightly later test taking time to allow those students and applicants that really feel that they need to bolster their application with a better step 2 CK, and leaving some of those earlier dates open. Now, it's really tight, and this is easier said than done. But I think that's kind of the stance that I would have if a student came to me. I would look at their score and kind of get a feel for whether or not I felt it was okay for them to defer a little bit, not extensively. Again, like Dr. Lee Sauerwein was saying, having that step 2 CK before rank list time is probably beneficial to the programs, but you can kick that can down the road a little bit to benefit your fellow applicants and fellow students in the short term.
Oh, go ahead. A point that I just wanted to interject there would also be based on what you said, Dr. Story. If someone did have a low step 1 score and, for example, was not able to get in to take CK, kind of any recommendations you might also have for the panel?
Well, you got to use the application. You got to use what you have at this point in time. And if, you know, you can't get in to do step 2 CK in a timely fashion, and your step 1 score is not what you feel was adequate or representative of what your performance ability is, then what you really need to do is highlight the other components of your application that do present you as a strong applicant.
Mm-hmm.
You know, you really, for those of you who have a home EM rotation, you really need to do excellent work clinically during that rotation and highlight that, okay, step 1, which was taken before I even started my clinical rotations, yes, I made this score, but look where I've come since then. And ideally you can do that with step 2 CK, but if you don't have that opportunity, I still think one of the strongest parts of your application is your SLOE, is, you know, what you've done during an EM rotation clinically. And this is a representation of what other EM faculty think about your ability in emergency medicine. So I think a really strong SLOE that has a really, you know, functional narrative that benefits you probably can help you with a lower than expected step 1 score if you're unable to showcase step 2 CK.
Thank you. Thank you.
Yeah, I totally agree with everything you just said. You know, unfortunately, there is going to be that subset of students that are kind of most impacted by this inability to take their step 2 CK. But, you know, especially talking about step 2 CS, I mean, we know that that's not going to be available for the entire application season. So, you know, I think we need to, as a, you know, specialty from our perspective and from like the applicant perspective, that's filed under things we can't do anything about. So it wouldn't be something that I would focus on as you're, you know, getting your application ready. Like, oh man, I really wish I had gotten my step 2 CS score in. Similarly, I've had a couple of students that have asked me, you know, there have been kind of last minute seats that become available for CK. Should they take a last minute seat and go ahead and get it and like get that check mark checked for their application? And I would say if you have an opportunity to take CK, you're going to want to make sure that that score is representative of your abilities. So I wouldn't take it if you weren't yet prepared to, if you hadn't been studying for it, just to check off the box and say, yeah, I have it completed as part of my application.
That's very helpful. Thank you, Dr. San Miguel. Do any of our APDs have anything to add to that, or should we go on to the next question? Good, okay. Along those lines, you know, the MSPE is traditionally a letter that the deans write to programs, kind of a very comprehensive letter, including a lot of information just about the student from, you know, the beginning of medical school to where they are now. Is there anything in particular that you would be looking for in an MSPE? For example, you know, our institution's rotations were canceled and only restarted up again in August, or, you know, we canceled all away rotations and we do not have a home EM institution. Just, you know, what kind of things you might want to see in an MSPE for students this year who are applying for EM. Dr. Oh, yeah. Okay.
Yeah. I think there are a number of things that are helpful. Just in general, I do think that there's often a part of that dean's letter that includes a narrative that highlights some of your most significant accomplishments within medical school that are particular to you, or a little bit about your background. And I think that those are universally helpful. There's other parts of the dean's letter that are also very useful, and those are the ones that detail your performance and how you did along the way. They often will give a graphical representation of your performance and put you in context of the rest of your class as well. So those will continue to be useful. I do think that this year it will be even more important that we know about what your clinical experience has been within the past year, and also a little bit more about the ways in which your school evaluated your clinical competency, if that's possible to get in, because, you know, some of the benchmarks that we would typically have are not really going to be there. Step 2 CS, for example, although it doesn't really weed many people out, it does at least you know, show that you were able to perform in that clinical environment. The SLOEs that are the same, or you know, those are even a more powerful way to look at those things, and those just won't be there. So any way that the school can communicate to us exactly what you're able to do, how they've been able to see it, what sort of competencies you have, I think those will be useful too.
Dr. Lee Sauerwein?
Yeah, I agree with Dr. Hartman. I think in general, I don't expect the content of the MSPEs to change too much. You know, the parts of the MSPEs that are the most helpful that Dr. Hartman had highlighted, I think are relevant from year to year in terms of the graphical representations of, you know, where you are clinically compared to your peers, in terms of the special qualities that you have. You know, I think that it is helpful if that particular institution were able to just make a sort of statement in terms of what the clinical, you know, availability was for rotations for everyone in that medical school. So probably that would be something that I would look for. And if it weren't present there, I would just probably want to see it somewhere else in the application, so I understand if you don't have a home institution, for example, you know, why there was that limitation.
Yeah. If CS, this is just an offshoot question, if CS is canceled, will you be looking, for example, more closely at OSCE reports or other forms, or primarily just like clinical evaluations?
I think for me, the SLOE really says it all. Mm-hmm. It is the best place to put your clinical abilities in the context of your performance within the emergency department. You know, and this is my opinion, but it's also been well studied that I think in the literature that clerkship directors, residency program directors really find the SLOE to be one of the most helpful pieces of information in making a decision to interview you, and then also making a decision to decide where to put you ultimately on the list.
Okay, moving on to actually virtual interviews. So the recommendation has been made this year that all interviews should be moved into the virtual format. Our recent statement with the multiple organizations also suggested that there should ideally be a cap of 17 interviews, with, you know, the ideal number being 12. So how is your, if it's already in the works, how is your program kind of gearing up towards handling this year? What are your thoughts towards the cap? And also, will you still be interviewing the same number of students this year, even given all the differences and the fact that it's turning into a virtual format?
Yeah, that's like, oh, go ahead, Nick.
I'm sorry. No, I will give the same caveat that I've given a couple of times, in that these things are still a little bit up in the air, I think, for a lot of programs, and that would include us at Wake Forest. Our general plan, though, is to interview approximately the same number of students that we have before, and try as best we can to recreate the kind of interview experience that you would have in person. So that will take a lot of different forms and different approaches to making that happen as best we can. I think that it will be important. Again, I do think that this guidance is real, and this is not wink wink. We really want you to try to keep your interviews to a reasonable number, both for everyone's good, in terms of equity for other students, as well as for the good of you, making sure that you are just interviewing at the places you're most interested in, and not sort of wearing out interviewing in places where you might have less interest. So we hope that you will be able to put a lot of thought at the beginning into the places that you want to apply. Maybe even more so than what has typically happened in the past, to make sure that you're targeting the places that you really have the most interest in. So I would really take this that guidance in terms of number of interviews seriously.
Yeah, I would absolutely agree. And, from our end, in terms of helping you to make your decisions for where to interview, I think that programs are kind of universally looking at ways to sort of best give you an impression of what we are about, what the personality of the program is, what we think is really special about our program, so that you can use that information to make your decision about which places to interview. And I will fully admit that I think virtual interviews, it'll be easier to just like step in and, register for a spot. So there is that benefit. And I recall I did 12 interviews when I was interviewing for residency. And at the time it felt like overkill. Because I will say, virtual or in person, by that 10, 11, 12th interview, you are tired of talking about yourself. And to be honest, I think whether virtual or in person, your best performance for an interview may be either at the beginning or the middle of the interview season. I think towards the end, you get asked some of the same questions, and so it doesn't really feel like you're responding organically. So you may be tired of kind of saying the same thing, and things start to just kind of mix together. So really, I echo what Dr. Hartman is saying, is truly only apply to the programs that you would be, willing to go to, that you think are a good fit for you based on a good review of the materials available.
Thank you both so much. Dr. San Miguel and Dr. Story, how are you kind of planning to advise, or if you're already advising, how are you planning to advise students, given this new target number, what programs they should try to target, who should be higher or lower on their list, and kind of just how they should overall approach this new limit that's come up this year?
Well, first of all, just in case the numbers seem arbitrary, the AAMC has pretty good data extending back several years that show kind of a law of diminishing returns once you get past 12 interviews. your likelihood of matching doesn't really continue to rise after you get that 12th interview. So that's where that number comes from. And the cap of 17 is merely to prevent people from, essentially hogging, at the expense of worse words, of hogging all the interviews, right? Again, speaking in terms of equity, limiting it to 17 with a goal of 12, I think is a reasonable number. Now, if you're couples matching, if you're in some of these other, if you're in a grouping of students that is not a traditional applicant, then you're probably going to be pushing that 17 range. If you're a pretty traditional applicant, I think 10 to 12 should be the goal. I totally agree with Dr. Lee Sauerwein. I thought 12 was probably one or two too many at the time when I was coming through. And knowing that it's all retrospective, right? But you're actually forced to do it this time based on the numbers. And so that's where those numbers come from. As far as how I'm going to be advising applicants, and I really think that students should try and find someone they can talk to that will go over their application, go over their performance, and give them some realistic and meaningful feedback on where their application should be directed. If you scored 265 on your steps and you've got all honors on your SLOEs, yeah, you can pretty much pick and choose, your 12 to whatever, up to 17, but you probably don't need that many if that's how strong your application is, and you go where you want to. If you're in that middle ground of an applicant, or even on the lower end of the applicant based on scores, based on grades, then you need to be realistic on where you're sending your application because of this cap number. If you're only able to apply or accept 17 interviews, then what you want to do is really kind of take a look and say, okay, maybe make a couple of buckets and say, this is my top programs, okay? But maybe it's a little bit shooting high for it. Maybe you're kind of like shooting for the moon at that. And it's not that you shouldn't do that, but you don't want to put all of your eggs in that basket. You want to maybe have some other interested institutions that you like that may not be quite as rigorous as far as their application or interview process as some of the others. And I think having a relationship with an advisor who's able to look at your application and all of it in its entirety and say, maybe we should consider some other programs to mix in to increase our chances of getting to that double-digit interview slot, 10, 11, 12, something like that. Because that is still the goal, is to get interviews at places that you want to go. And it's just going to hopefully keep people away from spending a ton of money, because it costs money to apply to these programs too. So that's the other benefit of this cap, is saying, okay, not only do I not have to travel, that's going to save me some money, but I'm also going to be limited to how many applications I can send out, which is going to save me some more money. So really give that some thought, do the research. There are plenty of places online to get information. You can contact residents at these institutions. You can contact faculty there. A good thing to do would be to talk to your clerkship director or your program director and say, hey, have we sent any residents recently to these places? Talk to your deans and say, do we have students who have matched in emergency medicine at this place? Do we have contact information? Can I get some meaningful information for that? Because you're not necessarily going to get to go visit for a virtual interview. And that'll give you just a little bit of extra information, more so and more personal than what's available on the web.
Thank you, Dr. Story. Along those lines too, if you find yourself in a situation where you really don't have an advisor, we are here for you. The RAMS organization is, so, definitely feel free to reach out, and we can do what we can to also try to connect you to someone who may be able to advise you better. Dr. San Miguel, do you have any thoughts towards the question I asked Dr. Story regarding how you're advising students in choosing which programs to apply to?
Yeah, again, I totally agree with what Dr. Story's saying. I think it's nice that this cap has been kind of like written down and put down in the consensus statement. The reality is it's not that different from what we've been advising all along. But I think that having it written down helps people realize that this really is what everybody is expecting. I think the challenge in limiting and trying to figure out where to apply for a student, I do empathize with them because there's not a list of all of the EM programs ranked in competitiveness from like 1 down to however many programs there are these days. So it can be difficult to know, well, I just know that I want to live in Cleveland. I don't know how competitive the programs are in that area. So I think it is really essential to have that advisor that you can go to with your application and with your list to say, does this look realistic? Am I going to hit my 10 to 12 target? And so I think it's really great that RANS has that service to connect students who maybe don't have access to an advisor at their home institutions with folks who can kind of help them out. In addition, to kind of piggyback on what Dr. Story was saying, I think we're going to be reaching out to our emergency medicine interest group here at the College of Medicine. And through them, we're hopefully going to kind of standardize this process of getting feedback from the last couple of years who've gone on to residency in order to help our applicants this year kind of know what their experiences have been, at least at those home institutions, just because they have that same basis, having all rotated here at OSU and having all gone to the same College of Medicine to kind of compare experiences so that our applicants can get a little bit of a better idea than they would otherwise about the culture of a program, about the strengths and weaknesses of various programs. So I'd encourage anybody out there who has a strong EM interest group of their College of Medicine to do kind of like a similar thing to try and reach out systematically.
That's a great idea. Thank you both.
Adrian,
Yeah.
sorry to interrupt. One additional plug as far as students that don't have advisors. The Advising Student Committee in Emergency Medicine is also available. All you'd have to do is do a search for it. So Advising Students Committee in Emergency Medicine, and there's a whole host of resources for students on that one as well.
That's wonderful. And we're actually going to be having a follow-up webinar with our CDEM leadership and court as well. So they may also be able to give some other resources that might be available for students who don't have, advisors that they feel that they can really go to at this time. Thank you. Thank you both so much. So the big and loaded question, and if you've already covered parts of it, it's okay, but how will your programs be deciding who they want to interview this year? Dr. Lee Sauerwein and Dr. Hartman. And what types of people do you think you'll really be searching for?
I think that the things that we'll be looking for will be very similar to what we've looked for in the past. I think most programs feel that they have a good system down for identifying people that will thrive in their residency. So I think that you will see residency programs lean on that model and that way of thinking. It goes back very much to what Dr. Lee Sauerwein was saying before. What is your record of accomplishment? How have you the things that you've done in life, have you really kind of stuck with it and accomplished things? Those tend to be good predictors of success in a lot of ways. We won't have some of the other distinguishing factors that we are used to having in terms of more SLOEs and certain test scores and those sorts of things, but I think that won't really change fundamentally what we're looking for. And I think we've mentioned a few things that we'll have to scrutinize even a little bit more carefully than what we have in the past, things like personal statements and MSPEs, and then that, of course, that that group SLOE that comes from your home EM institution. All that will be very important.
Thank you.
Yeah, absolutely. I think even though all of this feels very new and very strange, I think the process of selecting who to interview will probably feel more same than different. As Dr. Hartman had said, probably, most of the components will be there that are there every single year. And so, we'll be looking at the numbers, we'll be looking at your MSPE, we'll be looking at your personal statement and your SLOE. I think the only change may be the difference in the number of SLOEs, but we trust the institution who's writing the SLOE to give a fair and balanced view of, who you are and how you perform clinically.
Thank you both. You know, I know we probably have a lot of, you know, international medical graduates, people from DO programs, or even people who might not have matched last year and are trying to match again this year. You know, especially since away rotations are canceled and they may not have the opportunity to kind of shine on a SLOE from an away rotation. What would you be looking for, you know, for example, from an international medical graduate on their application? And what kind of advice could you give them, especially since, you know, the situation is so different right now?
Yeah, I think the most important thing, you know, for any applicant who is applying to emergency medicine is to make sure that you are the right fit for a program, and to be really clear in terms of communicating what that program is looking for in terms of its applicants, and trying to decide where you want to be spending your 12 interviews. You want to be going to places where you have some reach programs and some that are kind of middle of the road, and you know, making sure that you have kind of a broad representation. And I think if you are in one of those special situations, it may be helpful just to reach out and say, hey, you know, how do students typically with my background fare? You know, do you think that it'd be reasonable that I interview with you? So it's okay to reach out and kind of communicate those things, and we're not a black box. And you know, we're happy to you know, have those type of discussions, especially in a year like this where it's such a special circumstance.
Thank you, Dr. Lisa Sauerwein. Dr. Hartman?
I very much agree with that sentiment. I do think that there is some challenge here. This could be a little bit of a difficult spot for students that may come from programs that the residency, or for schools, excuse me, that the residency programs are less familiar with. There may be some tendency among residency directors to look more at students from institutions that they're more familiar with. So there is some of this that's incumbent upon us to continue to look carefully at every applicant and to be inclusive and give everyone a fair shot. I agree that it's useful to try hard to identify the programs that would be a good fit for you, and then reach out to them in a very personal and compelling way to explain why you might be a good fit. And I think you'll find that meets with success.
Thank you.
And I will probably add on to that you don't need to feel compelled to do that for like every single, I think it's 249 programs in the United States now. So, you know, it's okay to be sort of targeted in those inquiries and maybe limit it to just the few that you truly are interested in, that you're really hoping to have an interview at. You know, I think it would be really challenging to sort of cast such a broad net, but I think some targeted inquiries would be very reasonable.
Thank you.
I would just add on, I think this is another place where alumni network can be really helpful. As our program directors were saying, I think this year's right now feels very different, but is really going to be more similar than it is different in terms of the application process. So seeing where alumni have had success previously getting interviews and matching, I think is going to be really key to figuring out where you should best apply.
Great, thank you. Dr. Story, did you have something to add?
Yeah, just again, not to beat a dead horse, but the CORD Advising Students Committee has specific application guides, like applying guides, that are specific to, you know, the applicant that doesn't have a home EM residency, the applicant that is in the military match, the applicant that is couples matching, or an international graduate, that are very specific and have a lot of really good information specific to those populations, and can probably answer a lot of the questions that you're starting out with right now.
Sounds good, thank you. And as I mentioned earlier, we are definitely planning to have follow-up webinars. So we will be also trying to make sure that we can try to help target any groups that may feel somewhat at a disadvantage through these. So definitely stay tuned, and you know, we're here for you. We're going to help everyone achieve their goals as much as possible this year. So you know, thank you all. So virtual interviews are going to be kind of a new forum, something new for all of us. I think over the last months, we've gotten somewhat accustomed to things being virtual. But what tips do you have for students to really shine in these? And, you know, it's really going to be a very short interim. The opportunities, you know, to meet the whole faculty and the residents and everything are going to be a little more limited unless, you know, your programs are planning on doing that. But for the panel, how do you recommend students can try to really shine on these virtual interviews? Go ahead.
From a logistical standpoint, I think we kind of stumbled into having a little bit of experience with this with the SVI over the last couple of years. So that was for anybody who's not aware, was the standardized video interview that was being trialed with EM applicants over the last couple of years. EM applicants took or participated in a standardized interview that was done virtually. There wasn't actually somebody on the other end of the screen, so they were testing your personal skills, talking to a computer. But it did give us, at least our institution, an opportunity to work with our students who were going into emergency medicine to do kind of like a practice run SVI with them. And we're able to give them just some good kind of like practical feedback about lighting, about the camera angle, you know, about professional dress, things that you may not like necessarily think about, but that come across in a video interview different than they would kind of in person. So I'd at least encourage everybody to, if they can't do it with their home program, to at least do like a trial run video interview with either other applicants or somebody that you trust can give you honest feedback about things that you can change, at least to make sure that you're getting your best, putting your best foot forward as you'd like to do on any kind of interview.
Thank you, Dr. San Miguel.
Just to go along with what Dr. San Miguel said, which I agree with everything he said, just to reiterate, treat it formally. You know, I think that it'd be really easy to kind of lull yourself into, well, I'm at home, or, you know, wherever you're doing this interview, it's my computer, you know, I've got limited exposure. I think it could be really easy to minimize or at least take it a little bit informally, and just make sure you're treating it with the formality that it deserves and that your interviewer is going to be expecting from you.
Very important, very important. Dr. Lee Sauerwein or Dr. Hartman, any feedback, or I can move on to the next category?
Yeah, I think that's great advice in general. Just make sure that you, you know, don't have a roommate walking around in PJs, that you have somewhere that's like a little bit, you know, uninterrupted to conduct your interviews.
Okay. Are your programs planning to try to do anything to kind of expose students more to kind of what your curriculum has to offer, since things are virtual and they might not have the opportunity? Or how would you recommend to the panel, how would you recommend, you know, students can try to get a feel for these programs, you know, that we're kind of losing that now with everything going virtual?
Yeah, you know, I think it goes all the way from the medical center on down. So at our medical center, I think that they're working on some general videos to kind of give you a understanding of what it's like to be in Columbus, be at the, you know, Ohio State Wexner Medical Center. And I think from a departmental standpoint, we're kind of trying hard to figure out ways to supplement the actual video interviews with experiences similar to the experiences that you would typically get any other year. So that includes opportunities kind of mingle with current residents, perhaps in a Zoom setting, so that you have an opportunity to kind of get a feel for that program, you know, get a chance to talk with the chief residents. So we do that every year. Yeah, so I think that we're working hard to definitely supplement in addition to the virtual interviews with the program directors, because we really recognize that the whole point of an interview is also for you to get a feel for the program and to decide whether that's where you want to make it your home for the next 3 or 4 years. And so we really want to work hard to have you understand as much as you can about what we're about.
Thank you.
Yes, you know, I think these plans are very much ongoing, and each program is trying to sort out what is the most meaningful thing, what are ways that we can try to recreate those experiences. But I think, again, a lot of the things that would apply in any other year still apply here. The opportunities that you'll get to interact with residents in the program are really important. I often tell applicants and our students that are exploring different programs that beware the program where you don't get to meet very many residents. Make sure that you get a chance to really talk with them and get a feel for what the culture and community is like there. And so programs are going to be looking for lots of ways to put that on display and to give you that chance to interact. So please take advantage of it and make sure that you prioritize those things.
Also, this is another great opportunity to lean on your alumni network. So if you know somebody, or if you know somebody who knows somebody who's at a program that you're interested in, it's always good to do your homework before your interview day. But I think that this year particularly, it's really helpful to get a feel for the program. You know, the likes, the dislikes, you know, what they think is really cool, or you know, sets that program apart.
Thank you. Dr. San Miguel, Dr. Story, do you have any tips? We kind of touched on that, on how you're advising students to rank, but anything else that you wanted to add to that? Or
Yeah, I think they both covered it pretty well. I think you're going to see a wide range of what programs are putting out there. I think if you have the opportunity to have a virtual meet and greet with residents, by all means, you need to take advantage of that. But I think you'll see a lot more, you know, probably short videos and stuff like that getting posted to social media from programs that are kind of promoting what they have to offer. And you should be searching those out for the programs that you're interested in, because every bit of information that you can obtain from the programs you're considering will help you make a smarter decision for you when it comes to put your rank list together.
very true. Thanks, Dr. Story.
Yeah, again, this is you know, a bit of speculation on my part, but when I went through the interview process, I had a list of things that I thought were like really important to me. But overall, I was just kind of waiting for like a place that felt like it fit well. And I think this year that's going to be a little bit harder to do, just because I think it's harder to get a sense for the culture of a place virtually, other than being there. And that's just again, in that category of things that we can't change completely. So I think being honest with yourself about what you think is important about a program and what you're really looking for, and then thinking about how you can formulate some questions to kind of figure out if this is the place for you, might take a little bit more conscious effort this year on applicants' parts and on programs and thinking about residents than in previous years.
Thank you all. And then one last question regarding interviews. Just because everything is kind of getting pushed back this year, I believe ERAS applications will be submitted on September 1st, but only made available on October 21st for students. Will your traditional schedule for interviews still be in place, or will that be changed at all? Dr. Lee Sauerwein or Dr. Hartman?
I think that, again, is still in a little bit of flux. The trend has been that the calendar keeps moving up. It used to be that we started in, you know, say November, and now we have firmly been beginning in October for some early interviews. But it seems like, based on the calendar that we're getting, that's going to need to be pushed back a little bit from what it has been the last few years. I think, though, that you'll still see the same general structure in terms of the calendar setup. Likely early interviews, perhaps late October to early, November. But that will vary from program to program, and some programs are working together to try to standardize their invitations and things. So you may see some things about that.
Yeah, I think that's a pretty good explanation. I don't anticipate that the season will change significantly, maybe here or there by a couple weeks, but not like a huge dramatic shift.
Okay. So not, for example, going into February or anything like that, right up to the rank list time.
I'll never say never,
Okay.
but I think we're hoping to kind of keep it on schedule.
Schedule. Okay. Thank you.
I would be surprised to be doing interviews in February.
Okay. Thank you both. Moving on to our next topic about supplemental learning opportunities and preparing for intern year. Just in general, you know, to our APDs, what would you like to see in applications? Or actually, I can open this up to the whole panel. You know, what would you really recommend students can do to kind of bolster their applications this year? How can they really be prepared for intern year, and what will you be looking for since, you know, a lot of the clinical experiences they traditionally might have had are changed prior to interviews as well as, you know, the rest of the year? Just thoughts towards how they can bolster their applications and prepare for intern year.
Yeah, I think, you know, to be honest, I think that those are two separate goals.
Mm-hmm.
You know, number one is how to really make yourself kind of leap off the page and shine. And then number two is how to be a well-prepared intern on July 1st. You know, I think it's probably easier to address the second part of that question. And I would actually go all the way back to the first question that you asked, and Dr. Story had responded about the types of rotations that might be really helpful. So I think in general for every year, you know, the dermatology rotation, ophthalmology, the radiology, those are the things that, you know, we really, it's really helpful to have that skill set going into intern year as an EM resident. You know, the other thing that I would probably say in terms of supplementing your own knowledge is that I'll put in a plug, is the Alien Bridge to EM program that just came out. I see some nods here, so I'm not the only one who's excited about it, but essentially I think they're putting together an asynchronous, meaning you do it on your own time, you know, 8-week program that really covers the foundations of emergency medicine. And so I think that that's going to be really good for everyone who is going into emergency medicine, especially since your fourth year EM rotations are going to be reduced in terms of the total number of weeks. So it's important to still build that foundational knowledge and kind of understanding of how to hit the ground running in July.
Thank you. It's open to the panel, so whoever, yeah. Dr. Hartman.
In terms of other experiences, perhaps to bolster your application, this I think is challenging. I think there's been some suggestions that maybe get into a project, and that can be useful if that opportunity is there for you, and there's something that you can do while your clinical experience is a little bit more limited for this period. So I think if there are opportunities within especially within emergency medicine, if you can get involved in a project, something that you are passionate about particularly, I wouldn't necessarily do something that you really don't like, because it could end up being something that you have to talk about a lot in your interviews. So so if there's something that really fits the bill, and you can throw yourself into it and get something out of it, then I think that can be valuable. I wouldn't necessarily do something just to do it though. Look for the right fit there. Otherwise, do the things that we talked about before. Make sure that you shine in your EM rotation, and do the things. Take advantage of the opportunities that you have here in medical school to prepare yourself for intern year.
Thank you.
To echo Dr. Lee Sauerwein, I'm very excited about the Bridge to EM program from ALEM as well. I think they put out some wonderful materials and resources, and I think that's going to prove to be another one. So that's a great place to start. An additional place that you could consider is, you know, within your own EMIG group at home, if you have one, talk to whoever the faculty liaison is and say, you know, we're not getting the experience maybe with procedures that we typically do, either because rotations are shorter, because I'm getting to do fewer rotations in general within emergency medicine. You know, maybe your suturing skills won't be what they would have been had you been able to do another rotation or two. So, you know, talking with that faculty liaison and say, hey, is there any way we can get a suture lab later in the year? Is there any way we can do an airway lab? Because I know here we're limiting the number of people that are in the room doing airways. So students are not going to have that experience necessarily. But if we can at least, yes, I mean, it's still artificial. I mean, that you're innovating a dummy, that sort of thing. It still gets you a little bit of muscle memory and gets you a little bit of experience as to what it's like to look down, someone's airway and try and stick a tube in there. So talk to those liaisons, talk to your faculty and say, look, where are our opportunities to improve ourselves going into intern year, even if it's just from a procedure standpoint? Because I think that a lot of places have airway dummies. They have models to do central lines and that sort of thing. And just find out what's available and make sure you're utilizing those.
Excellent points. Very true. Thank you, Dr. Story. Dr. San Miguel, do you have anything to add to that?
Yeah, I think those are all great ideas about how you can kind of like fill the time of your fourth year of medical school. I'm a little bit old school. I'm a big fan of like actually going out and seeing patients, as I'm sure everybody else is. So I think, any big clinical experience that you can get that's remotely relevant to emergency medicine is going to end up being helpful. But I would also say, for those applicants that maybe aren't at a school that has as robust resources in their fourth year, I wouldn't worry about this too much. Once you get into residency, we can teach you how to be an emergency physician. That's our job. So if your EMIG isn't able to set up simulations and procedure labs, or you're only able to spend your one rotation in the ED, we understand that, and it's still going to be okay.
Thank you all very much. If no one else has anything to add, we will go ahead and open up the floor for questions from our participants. If the chat can be enabled, we can go ahead and let our participants start asking any individual questions they may have. Let's see, from Matthew Fisher to everyone. Your students have a semi-unique opportunity where your home program has an EM rotation where they can get a SLOE, and our university has an affiliation with another EM department where they can get a second SLOE in another town. Many of our students have been accepted at both and are questioning if they should do both since they have this opportunity. Should they, one, do both, get and upload a second SLOE and explain that they had this unique opportunity, or two, do both and only upload one SLOE, or three, will this be viewed negatively and they would be better served doing it at only one location and getting just one SLOE? Perhaps we could direct that towards our APDs and their thoughts towards, if a person gets two SLOEs from like a sister institution or the same institution with a different department, the affiliation.
I think this is a bit of a special situation. There has been a little bit of discussion on some listservs among program directors about this, and I think in general that that is considered okay if you're doing that, especially because in many of those cases those rotations aren't really open to others anyway because of travel restrictions and that sort of thing. So there's not as much of a question of equity there. So if you wanted to get two different, and if they were true, especially if they're truly different kind of clinical experiences and you have that opportunity, I don't think that's going to be looked on poorly. I don't know that it provides a tremendous advantage over anybody else either though. So again, the one SLOE standard is really perfectly fine.
Yeah, absolutely. I agree with that. And I would say that if you do a rotation, just get a SLOE from it. So you don't need to like hide the fact that you did another rotation. If you feel like it's going to help you clinically to pursue that extra, 3-4 weeks of emergency medicine, and certainly, pursue that if it's available to you and if it's not taking away a spot from someone else.
Thank you. From Marjorie to everyone, any special advice for osteopathic students? Open to any of our panelists.
I don't think there's any specific advice that I would give that would be different for the DO students. I think there are certainly programs out there that don't necessarily take the COMLEX as, you know, as a standardized test that they accept as part of their application process. So getting, you know, USMLE step scores there would probably be beneficial. Again, it's going to be difficult possibly to get those taken based on availability, but that might be one thing that I might tell a DO student, is to try and have both if possible. But other than that, I don't know if the application process this year is going to be much different. There's a lot of DO programs out there that have residency affiliations and are going to be able to get their EM rotation and get their SLOEs. And for those that don't, I think they fall into the same boat as MD program students that don't have a home EM residency either.
I would like to also say, again, we will be having follow-up webinars specifically geared towards, you know, osteopathic students, IMGs, as well as, you know, be having different, you know, opportunities for people who feel like they might benefit from those coming up in the coming months. So please stay tuned. Thank you, Dr. Story. Did anyone else have anything to add to the osteopathic question? Dr. Lee Sauerwein, Dr. Hartman? Okay.
I think this is going back to number one, seeing where the alumni from your school are going in terms of the, you know, well-trodden paths. I think that goes both ways, right? Like as program directors, sometimes we're like, oh, like we know people from this school, like, but then also from you as an applicant that it's helpful. And I think that this, again, goes back to the making sure that you clearly communicate with that school, your interest in the school. You know, if you do truly have an interest in, for some reason. So whether it's a geographic interest or an academic interest for a specific area.
Thank you. From Jasmine Shaw to everyone, you mentioned pushing back your step 2 CK. If you had a decent score, can you throw out a number of what this minimum might be? I'll send this one to Dave Story just because Dr. Story was the one who had mentioned that, and then open it up to everyone.
I guess I walked into that question, didn't I? You know, I don't think there's a set number, and I think if you talk to different program directors, you'll get different numbers. You know, I think the average right now is in the low 230s, if my most recent memory is correct. And I think if you're in the 230s, I think that's a very reasonable score. That you wouldn't necessarily feel that you had to push for step 2 CK right now to bolster your application. But that is merely my opinion, and certainly not anything. And you're not going to find anything that's set in stone that's out there on the internet either. So it becomes a question of where you're applying, where you're wanting to go, and you know what your score is in relation to the other applicants that are going there. So it's not an easy answer, but I would think, you know, 220s, 230s are pretty reasonable scores, and anything above that obviously is pretty strong. But you know, that's kind of the range that I was thinking in my head.
I think it's also important to take that in the context of your overall application file, right? So your clinical rotations, you know, your third year clerkships, your SLOE. So in my mind, I like to take a look at an application holistically, and I don't know that there is really like a firm cutoff. You know, perhaps if you're more than like a standard deviation, you know, on either end, it kind of stands out a little bit, and so I want to know why. But aside from that, I don't really have a number.
Okay, from Emma to everyone, and this might be a question potentially geared more towards our CORD and CDEM webinar next in a couple weeks, but my school requires 3 sub-internships as a graduation requirement. Would it be acceptable to pursue more than one away rotation or SLOE for that reason? Dr. Hartman or Dr. Lee Sauerwein, do you have any thoughts towards that? How would OSU view that, or how would Wake Forest view that?
Yeah, I think that's possible that could fall under the category of extenuating circumstances, although there probably are options to do sub-internships in one of those EM adjacent specialties, and so that might be a useful way to fulfill the requirements while still staying within the guidelines that have been put out. So I still would advocate for generally trying to stay within the guidelines as much as you can. I know everybody feels that there is this pressure to get more SLOEs, and that has been out there for some time, but I do think that this year one really is fine. But if you need to do that as a graduation requirement, if you do an EM, like Dr. Lee Sauerwein was saying, if you do an EM rotation, then you should probably get a SLOE from it.
Yeah, and I think I would also add to that, like, if we always see this kind of like ebb and flow in terms of the EM students really being at the bulk of the fall, the summer and the fall, and then there's always much more space towards the end of that academic year. So if you just need it as a graduation requirement and you're hoping not to take away a spot from someone who's EM bound, then one option would be to schedule something in January or February. As a way to clear some space for the folks who really need a rotation.
Thank you, Dr. Lee Sauerwein. The next question is from Marjorie. Will not having a SLOE until November prevent someone from getting interviews from an orphan student? Dr. Hartman or Dr. Lee Sauerwein?
Go ahead. I really like to see a SLOE. I think this year may be an exception. So I think that it'll have to be kind of couched within the, application field as a whole. I think that one approach, if you really can't get a SLOE until November, that's okay. Don't panic. There's plenty of spots after that. Once you have your SLOE uploaded, just make sure that you're reaching out and communicating with all those programs that you're interested in to say, just to let you know, I've uploaded the significant, the significant portion of my application has now been included. And I'm still really interested in your program.
Perfect. Thank you. From Danny to everyone, urology will be sending out all interview invites on a single day. Any discussions currently to have a similar interview season for us to simplify choosing our 12 to 17 interviews? Have either of you heard, or has anyone on the panel heard anything about that?
I've heard kind of preliminary discussions about similar kind of strategies, but nothing that uniformly has gotten support for that.
I will say that the benefit is this season is that you won't have to go through, having to schedule your travel and your accommodations and all the logistics. And so if you end up getting an interview to a place that you really like, I think it's easier to just accept and go ahead and do that interview. To be honest, I haven't, I think it would be really hard for the field of EM because we're such a large field now to coordinate. But I think that that's to be determined from the big national organizations.
Sounds good. Something to consider. From Sala Sohail, I apologize if I'm not saying that correctly. Hello, thank you for doing this. I am an IMG. I was scheduled to do my aways in April and May in EM. However, everything has been canceled. My home institution in Pakistan does not give out SLOEs. In the recent changes of including virtual aways, where can an IMG apply for one? It was hard enough getting my now canceled away rotations. So where can she go about finding a program to accept her? Her program doesn't have a residency in EM. Anyone on the panel, Dr. San Miguel, Dr. Story, Dr. Sauerwein, Lee Sauerwein?
Yeah, I think that's tricky because virtual aways are such a new kind of concept and idea that there's not yet, that I know of anyway, kind of like a centralized database of places that are offering it. I know, off the top of my head, Wash U and St. Louis and Emory are offering virtual aways. If you have any connections with any advisors who are on like the CORD listservs, they're often advertised through there. But I don't, other than, just kind of cold call Googling, know of any great way to find which places are offering virtual OAs right now.
Any other? Okay. Mm-hmm.
I'm not sure if there's been discussion as to whether or not SLOEs will be resulting from those virtual OAs, and even if they are, how they will necessarily be viewed, just because it's not based on clinical exposure, clinical experience, and feedback based on that. So a lot of questions around that, very difficult situation. And yeah, I mean, I think I would probably start with exactly what Dr. San Miguel said with regards to trying to find those. But I would probably inquire directly to those programs once you find them if a SLOE results from them, so you know that going in.
Any thoughts from the other panel? Okay.
The little bit of discussion that I have seen about that issue, the SLOE issue, is that if SLOEs do result from virtual interviews, they probably would not be given the same weight as a true in-person experience. And so I'm not sure that I would look to virtual ways as a method for getting a SLOE. It may be more beneficial just in terms of the preparation, the experience that it gives you in those terms.
Thank you. So Dr. Passierstein's question might actually be better left for our next webinar, because it's a little bit more about the technicalities regarding the rotations with CDEM and CORD. But I will really encourage you, Dr. Passierstein, to, if you can, log on to that, unless one of our panelists has an opinion. His question is, he's an advisor for about 30 students. Since our school requires 24 weeks out of their 4th year to be rotations with direct patient care, why are we limiting our students' experience to only 4 weeks of EM? This suggests that it is preferable for our students to do other rotations instead. If you prefer, I can defer that to the conversation with our CORD and CDEM directors when we have them on in a few weeks. Would that be all right with all of our panelists, or does anyone have an opinion? Okay. From Mustafa Alam, how can unmatched reapplicants prepare for the ERAS 2021 application cycle?
I would definitely recommend taking a look at there's a core document that gives advice for students who are reapplying in EM, and it's full of some great suggestions. I think the overarching theme there would be doing a careful consideration and a deep dive as to the reasons why you perhaps didn't match the year before, and trying to address those head on within personal statement, within experiences that you're seeking out, all those other things, and showing how you've gained clinical experience and things that will help to speak to the things that may have kept you from matching the first time. But I would definitely recommend that that document as a great guide to where to start.
From Katrina to everyone, will narrative letters not be helpful anymore if letter writers have already uploaded narrative letters from non-EM specialties to ERAS? Should these letters be written as non-EM SLOEs? That's a great question. So converting, letters from non-EM specialties, should those be rewritten into non-EM SLOEs?
I think there is some overlap between what the narrative letters, who those folks are, as compared to the folks who are going to be writing your non-EM SLOEs. As I had kind of referenced a little bit earlier, I think that those narrative letters are really great for folks who've, supervised your research for 3 years, who, can really advocate for you as a person and as a student. I envision that the non-EM SLOE will speak a little bit more to your clinical abilities in an observed clinical setting, in addition to putting it in the context of all those other traits.
And there is a template coming out soon, correct, with written by Cord, and so that would also be something that would really help guide the letter writers as to what your programs would be looking for. Is that correct?
And certainly if there's someone who fits in that overlap of the Venn diagram between like the letter writers and the ideal non-SLOE writers, then I think it may be reasonable to sort of convert. I certainly wouldn't have them write both, you know, and upload both. I think that you just may want to pick and choose at that point.
Thank you. From Matthew Fisher, does anyone see an issue with doing a rotation in November, December, January as an audition rotation at a place they really want to go to, and not so much for a SLOE if the student is allowed? That's a great question.
I don't see anything wrong with that intrinsically. You know, it's at that point in time, especially December, January, you've probably gotten a lot, if not all of your interviews probably already offered and in the books. And if it's really just sort of a fit test is trying to find out, you know, whether or not this is a place you'd like to go and that is being offered, I don't think I would hold that against a student for trying to improve their knowledge about a program to see if it's truly where they want to end up being.
Great point. Okay, does anyone else have anything to comment on towards that? Okay.
Okay. I don't disagree with what Dr. Story's saying, and I certainly can understand the motivation for wanting to do a rotation like that. But I think it's, you know, I guess I would just put our caveat that, you know, these are it's hard to say how it's going to be taken because this is a completely new kind of situation that we're in. So, and as part of that, you know, we talk about kind of equity of away rotations and trying to make the process as equitable as possible. You know, there's going to be some schools that aren't going to allow any away rotations all year. So you could imagine, you know, on like a grand scale of things, if half the students were allowed to do a rotation in November, December, January, and half the students weren't allowed to do a rotation in November, December, January, could cause kind of like an inequitable situation. But again, on an individual level, I certainly understand the motivation for wanting to do it. And I don't disagree with what Dr. Story's saying.
Thank you. That's a great question. Go ahead. Dr. Lee-Sauerwein, did you have something to say?
No, I think that that's a reasonable approach. You know, I would probably be more in favor of sort of the equitable approach that, you know, I think we truly, you know, I think we're expected as residency programs this year to really be judging you on the basis of your application package and on your virtual interview. So, you know, I don't want to make people feel like that's a situation that they need to get in.
Thank you. From Prague, Arya, to everyone, what if you have good rotation grades, great letters of recommendation from non-EM and USMLEs, but your SLOE or EM grade is not great, or the letter writer only does narrative letters? How does one overcome that?
I would say keep in mind that we want to look at applications in a holistic manner. And so if you have a lot of strengths within the application, that should shine through, and you'll want to do things to make sure that those are highlighted, both in the way that you put it in, the ways that you discuss things in your personal statement, etc. Keep in mind that the EM grade and that SLOE that you get is going to be an important piece of information. So do as well as you can in that environment. We understand that not everyone's going to get the perfect grade, and that doesn't mean that you won't be a great EM doc. So we know that we have some experience with that, and that we will want to look at your application as holistically as we can.
Thank you, Dr. Hartman. And that might be somewhere too, right? If, for example, if they wanted to get a letter from someone who was in a different specialty that was similar to EM, like a critical care doctor or something, would you maybe recommend something like that? Or okay. Never mind.
I think that was a good idea. I'm sorry, I had a technical difficulty there.
Yeah.
I think that is a very reasonable solution. Those non-EM SLOEs, those formats that will be coming out, that might be a very reasonable thing if you were able to then do a tox rotation, an ultrasound rotation, critical care, those sorts of things, and could get us a non-EM SLOE in that way. That would be fine too.
Thank you. From Sarah Wells to everyone, since this is great. Since we cannot show interest in a specific location, since we cannot do away rotations there, will geography still play a role in offering interviews to applicants?
I think it's reasonable. It's reasonable to be forthright when you're, you know, communicating with a program to say, it's really important to me that I'm in this area, and I'm really interested in your program specifically. But also, I think every year, I also want to hear from folks why, you know, they're interested in Ohio State, not just why they want to be in Columbus. So I want to make sure that applicants have kind of researched the program and kind of understand the personality of the program and what we're about, so that at the end of the day, it's a good fit and that both parties are happy. Because at the end of the day, this whole residency application and interview process is to try to figure out where you're going to be happy for 3 or 4 years, and you know what place is going to help you get to your professional goals.
Thank you so much. From Laura Vogues, I have the option to rotate at home with an EM physician who is able to write a modified SLOE, but we do not have a residency program. Would this carry the same weight as a SLOE from a program director? That's a great question. Open to anyone on our panel.
An EM rotation that can generate a SLOE is a good thing, and so that sounds like that experience would be fine. There is a little bit of extra value in getting a letter, a SLOE, or an experience at a place where there is a residency program, but that doesn't mean that other experiences aren't also useful and can also, you know, generate SLOEs that are valuable.
From Prague, how are Canadian IMGs looked at?
You know, to be honest, I think that it's kind of on a case-by-case basis in terms of, you know, which schools you're applying from. I think it's certainly helpful to me if I've had interactions with a student from that program in the past, so I can kind of put it in context. So it's a little bit hard for me to give like a universal blanket response to that. But I definitely think it's helpful to sort of understand, you know, what the differences in applying will be for someone who's an IMG from any school. So it's important to sort of understand those nuances and educate yourself so that you can be the best prepared to, you know, start the interview season.
So I have a private question, which I'll go ahead and open up to the panel. For those re-entering medicine as a 4th year after taking a master's or research year, should it be written somewhere in their MSPE or personal statement, et cetera, that their EM rotations were completed last year? Is there anything else that these students should consider when applying this year after taking a master's or research year? For any of our panelists.
So I was actually in this situation. I did a master's in clinical research between 3rd and 4th year. And so I think it will be evident from your application, and certainly your dean's letter or the MSPE will reference that. I think as much as, you know, the current folks who are going all the way straight through, it's also important just to make sure that you do have some clinical experience when you're actually talking with patients and interfacing with patients in your 4th year. So kind of what Dr. San Miguel was referencing earlier, make sure you actually have patient contact if you can, if at all possible, so that you're kind of fresh and not rusty.
Dr. San Miguel, were you going to say something also, or should I move on to the next question?
No, I think she covered it.
From Elizabeth to everyone, neither of the programs on this panel are accepting away students. Do you anticipate that students who are unable to get a standard SLOE be considered for interviews? And would you encourage these students to dual apply or apply for prelim spots if someone is unable to get a standard SLOE?
I mean, I think it depends again on kind of your entire package of application. I wouldn't pin your decision to dual apply or apply for prelim spots solely on your ability to get a true SLOE versus a non-true EM SLOE. I think the part of the purpose of the common statement coming out and even creating these non-EM SLOEs is to help level the playing field for those students. So I certainly think that you'd be considered for an interview even if you weren't able to get a standard SLOE.
That's the same kind of thing I'm hearing when I'm reading the message boards, like from CORD and from SAEM, is that same stance that, you know, this year is very unique in its application process and in the experiences available to the students this year. And so I think the recommendations from an equity standpoint, especially for students coming from programs without residencies, is to be aware of that, to be accepting of that, and to not automatically cross those students in particular off the list because they don't have a SLOE.
Great, thank you. From Richa to everyone, do you have any advice for IMGs who graduated more than 2 years ago and are unable to get additional clinical experience due to their restrictions right now?
It does sound like a challenging scenario. I think many of the things that we've discussed already would still apply in terms of making clear your rationale for the field, the experiences that are relevant that would make you a good applicant.
Let's see, from Sam to everyone, how many programs should a student apply to if they have a mediocre step 1, assuming the rest of the application is solid? Great question. Maybe I'll direct this to one of our clerkship directors.
I mean, it sounds like what they're describing is a pretty average application. So I would say they should probably apply to an average number of programs. So for me, that's usually about 3 times what your target's going to be. So maybe about 35-ish programs I'd invite you to apply to, assuming that you have a good mix of like highly competitive and less competitive programs.
Dr. Story, did you have anything to add?
No, I agree with that. I think, you know, just having programs falling into different buckets is kind of key with that, just like Dr. San Miguel said.
Okay. From Caitlin to everyone, my home institution is able to offer 3 different EM rotations, a rotation that will offer a SLOE, orphan SLOE, and subspecialty SLOE. Only one rotation would produce a true SLOE, so opportunities would not be taken away from other students to obtain a SLOE. How would this look to pursue all 3 of these EM rotations? We had a similar kind of question a little bit earlier, but this is a bit different. Yeah.
That is certainly a wealth of opportunities there. I think that is probably the exception in terms of what's available to applicants. And so I think for folks who are in that position, I think it's helpful in terms of supplementing your knowledge and kind of getting ready for intern year. I think it's important to sort of make that clear that you weren't sort of taking advantage or taking spots away from other folks. But I also want to emphasize that to the majority of folks who are not in that position, that we still really only just expect the one SLOE. And in the situations where you can't, a non-SLOE.
Great, thank you. I did want to say we have some input from Dr. Jubanyik, as well as, sorry, my mouse is taking a minute, as well as from Dr. Morrissey, saying it's really important for your video interviews to really come across in the best way possible. So really making sure you have, an organized bookcase instead of it being messy, that your sound and internet connection, all of those things are going to be really important. So, that's definitely something, making sure everything is as put together as possible for your video interviews will be very important.
I do feel like the messy bookcase was directed at me, but that's fine.
From Sam to everyone, is there going to be an actual cap on the number of applications, or can students apply to as many as they want to get to 12? Good question.
As far as I know, there's not a cap on the number of applications. It's really directed at interviews, and depending on what your application packet looks like, as we discussed, there you may want to vary that number, apply to more places. But as we discussed before, it's going to be very important this year, just like all years, but particularly this year, to be reasonably targeted in the places that you want to look at, and consider really focusing on the programs that you are most interested in. But as far as I know, there's not a cap on application numbers, unless somebody else knows differently.
Timothy George, your question is great. That would actually probably be something more directed towards our next webinar with our CDEM and cord leaders on it. Or if anyone on our panel also has any thoughts, but do you see these guidelines with one SLOE, no CS staying in effect for the next cycle as well, 2021 or 2022?
Like many things in our lives, I don't know.
Yeah. Okay. From Philip Case. Oh, go ahead.
Sorry, I just want to say I have no idea what's going to happen next year, but I think I was reading through the chat here, and somebody mentioned, I mentioned earlier that Emory had a virtual away rotation, and I think I must have misspoken and thinking of something else, but somebody clarified, I say, one of the PDs at Emory, they do not have a virtual away experience. So sorry if I misled anybody with that.
How many letter of recommendations in total do you recommend, including non-EM SLOEs? Probably towards Dr. Hartman or Dr. Lee Sauerwein. How many total letter of recommendations should students maybe try to target, including non-EM SLOEs?
I think that 3 is probably a reasonable threshold. I would try to get 3 of some variety, including the one formal SLOE. Maybe if you have an opportunity for a non-EM SLOE, that could be another, and then a narrative from someone who knows you well. I think that might be a reasonable kind of place to start.
Okay.
Yeah, absolutely. I agree with that. I wouldn't, go overboard and, shoot for like 5, 6, 7. Like at a certain point, it kind of feels a little bit like decreasing returns. And then also if it's really outside the realm of what we're seeing as the average, it can be sort of like, well, why did this person feel the need to have so many application letters? Like, I really only want to see the ones from the folks who know you well and can advocate for you, and then also whatever SLOEs that you can get.
Okay. So I think we have time for one more question, and then we'll ask our candidates or our panelists to give us, kind of any last piece of advice or remarks they may have. So this is from Nacha, and asking, I'm an IMG. I would like to ask if needing visa sponsorship will play a role in programs deciding candidates for their interviews and acceptance to the program. Maybe Dr. Lee Sauerwein or Dr. Hartman.
That is challenging, and I think that will be institution dependent, and they're, with different types of visas, et cetera, and what they're able to work out. These, of course, are very challenging times in that regard. So you'll want to talk and be explicit with different programs that you're that you're targeting about that issue.
So with that, we thank you all so much for joining us today. It was really a pleasure to host our wonderful panelists, as well as all of the people who joined us for this event. We really appreciate your time, all of your advice that you've given us, and I think this was a really helpful session for us. So I'd like to close if each of you would mind telling us just a piece of advice, serious, something humorous, whatever you might have to offer students as they go into this next cycle. What can they kind of carry forward from you?
I said it earlier and I'll say it again. Don't panic. Everything is okay. You are all in the same boat and we will all figure this out together. I think from our end of things, we're also trying to figure out how things are going to look, and so we'll all sort it out. But I think as a specialty, that's like one of our defining traits, right? That we're good at sort of rolling with the punches and sort of, making it work.
I couldn't agree more with that. And although it's that time is getting further and further in the rearview mirror for me, I do remember the mix of trepidation and excitement at this stage in your careers and in your lives. It is really an exciting time. I hope that you are excited about it. I know that this year seems a little bit more uncertain, but we really have the same goal that you have, and that is to get you matched up and placed in the best possible environment to further your careers and turn you into the great emergency physicians that I know you'll all be.
Yeah, just, I guess all I would say is continue to be flexible, understand that things are going to change. They're going to be different from institution to institution. I think the norm for this year is going to be the abnormal, and just kind of keep that in mind and be fluid. Just as a side note, when I was coming through my fourth year, I was coming from LSU and Hurricane Katrina came through. So as opposed to having no away rotations, I had all away rotations, and I did just fine. So I'm sure the counter of that and having no away rotations will be just fine too.
Thank you, Dr. Story. Dr. San Miguel, any closing remarks or advice?
Yeah, I'll just add, come March, we're going to have the same number of spots that need to be filled as we did last year. So we'll figure it all out together.
Great. Thank you all so much. We really do appreciate your time, your sage advice, and it's really appreciated, especially during this somewhat scary time for people since everything is so new. So we thank you again, and to all of our audience members, please stay tuned. We have some multiple of these coming up in the next months. We'll have CDEM and Cordon for our next one coming up here soon in a few weeks. So definitely stay tuned, and we're looking forward to everyone being great EM physicians. So thank you all again, and thanks to our panelists, and take care.